Hello, Medicos. Good day to all of you. This is Dr. BK for you, and today's class is on the larynx. So, the larynx I will be discussing in two parts. So, in the first part, I will be discussing about the cartilages, the ligaments, and membranes. So, that is the skeleton of the larynx. And in the second part of the larynx, I will be discussing mainly about the muscles, the movements of the vocal cords, and the nerve supply and blood supply of the larynx, and the clinical aspects. So, our learning objectives for today will be mainly about a short introduction on the larynx, and followed by that I will be discussing about the skeletal aspects of the larynx. So that is the cartilages, membranes, and the ligaments of the larynx. Now, first of all, what is larynx? So you all know that larynx, in a layman terms, it is called as the voice box. Okay. Now, the main purpose of larynx is two. The first purpose is it is a respiratory tract or respiratory passage. So it forms the upper respiratory passage. Okay, so mainly what happens is it also serves as a watchdog. So what do you mean by watchdog? Is it regulates the permit of or permitting the air or actually exit of air. So it regulates the actually the inspired or the respired air in and out. Okay, so as I told you, it is also called as the watchdog because second most important thing is the lining epithelium is ciliated columnar epithelium, and any foreign objects which might accidentally enter into the larynx is brought about by the cough reflex. So it irritates the lining epithelium of the larynx, and naturally what happens is it tries to actually push it out. So thereby the cough itself is a protective reflex. Then, as we all know, the next main function of the larynx is it is the organ of phonation or production of sounds. So this is mainly brought about by the vibration of the vocal cords. So the vocal cords are mainly what happens is uh, it helps to produce the sounds. So based on the pitch of the vibrations, the frequency and extent of these vocal cord vibrations, so different sounds are actually produced. Now this sounds is actually amplified or resonated by the nasal cavity and the oral cavity, and finally they are actually articulated into speech by the action of the tongue and also the movement of the lips. So all these only produce the speech. Okay, but the main sound part is actually produced by the what do you call the vocal cords. So the vocal cords not only production of sound, they also acts as a valve. Mainly they act as a exit valve, okay, for the air to come out. Okay, so with this short introduction about the larynx, we will try to see the extent of the larynx. So it is extending from the upper border of the epiglottis to the lower border of the cricoid cartilage. So that is the extent of the larynx, and inside what you have is the cavity of the larynx, which is mainly lined by the mucous membrane. So it is mainly lined by the mucous membrane. Okay, and then when you look at it, that is the inlet of the larynx. So from the inlet, what happens is you have the laryngeal cavity, and below it continues as the trachea. So further part of the respiratory passage, it continues down is the trachea. Now the inlet actually communicates with the laryngopharynx. So the inlet is usually open, and when the food enters the laryngopharynx, at that time during the process of deglutition, this inlet is closed. So otherwise the inlet actually is communicating with the laryngopharynx. Now, with respect to the vertebral levels, the larynx extends from the third cervical vertebra to the sixth cervical vertebra, 3, 4, 5, and 6. So it is present in front, not exactly in front. In front, you have the other fascia, retropharyngeal space, and then you have the pharynx part of it, and anterior to it only you have the larynx, but it is present opposite the third, fourth, fifth, and sixth vertebra. So this is the second vertebra with the odontoid process you are able to see here, and that is the arch of the atlas, which is a part of the first vertebra. This is your basi-occiput. So the vertebral level is C3 to C6 in adults, whereas in children, what happens is it is only present opposite the C3 and C4. Still, the growth is not completely what do you call achieved. So that is why it is opposite the C3 and C4 vertebra in case of the children. Okay, so then what about the dimensions of the larynx? So the vertical dimensions or the height of the larynx is approximately 4.4 centimeters or 44 millimeters. Whereas the transverse dimension is also the same, the width, but the anteroposterior dimension in case of males is higher than the females and in children. So the anteroposterior is mainly due to increase in the angle of the thyroid cartilage, which I will be discussing shortly. Okay, so that increase in the angle is also responsible for the deepening of the voice in case of males after the puberty. Now, today's class, as I told you, I will be discussing mainly on the what do you call the skeleton of the larynx. So that is the framework of the larynx is mainly made up of cartilages, and these cartilages are connected or supported with the help of the ligaments and the membranes. So the cartilages of the larynx mainly can be classified into paired cartilage and unpaired cartilage. So the unpaired cartilages are they are present only in single number, one thyroid cartilage, then you have the cricoid cartilage, and then you have the epiglottics. So the thyroid and the cricoid are mainly of the hyaline variety. So that means they have a tendency to get ossified, whereas the epiglottis is of elastic cartilage, or to be more precise, it is fibroelastic in nature. With respect to the paired cartilages, you have the arytenoid cartilage. Okay, so that is a pair of arytenoid cartilage you have. This arytenoid cartilage is again partly hyaline and partly elastic in nature. So the apex and also the one of the process, the vocal process, is of the elastic nature, whereas the remaining part of the arytenoid cartilage is actually hyaline in nature. Then we have two more small cartilages, pair of corniculate cartilage and then the cuneiform cartilage. So they are mainly seen here in the posterior part of the epiglottic fold, and also what you are able to see here, this is a thyrohyoid membrane which is thickened posterolaterally. So you are able to see a nodular cartilage and a rod shaped cartilage. Here you are able to see on top of the arytenoid you will have the corniculate, and then that should be your cuneiform cartilages. So corniculate, cuneiform, and epiglottis are all elastic type of cartilage, whereas your thyroid and the cricoid cartilage, so that is the anterior aspect and that is the posterior aspect. So the cricoid cartilage is of hyaline type of cartilage, and your arytenoid is some parts are actually elastic and the remaining are hyaline in nature. So now try to understand each of the cartilages one by one. So the first cartilage which you are seeing here is the thyroid cartilage. It is the largest cartilage of the larynx, and it is like a shield. So both the lamina, what happens, it is like a protective shield, and because deep to it you have the other part of the cartilage and cavity of the larynx deep to it. So since it is protects like a shield, so that is why it is like a shield like cartilage, and each thyroid cartilage has got a lamina. So you have two laminas and they are joined anteriorly at an angle, that is called as the angle of thyroid cartilage, okay, or the laryngeal prominence. Now this laryngeal prominence is very prominent in case of the adult males and called as the Adam's apple, because after or during the time of puberty there is a sudden spurt of growth in the larynx, and the angulation increases. It is about 90 degrees, so very deep angle you have, and that is mainly responsible for the deep voice in case of the males. Whereas in case of the females and in children, the angle between the two lamina of the thyroid cartilage is around 120 degrees, an obtuse angle. So you don't have a very, what do you call, deep angle here, and because of that what happens, the voice of the children and females is somewhat high pitched. Okay, this is actually the upper border where the two lamina meet is actually called as the thyroid notch or the superior thyroid notch. If you look at the each lamina, it has got three borders, mainly one upper or superior border, and then what you see is the inferior border, and then what you see is the posterior border. Okay, so three borders you will be able to make out, and each lamina has got an external or lateral surface and an internal or medial surface. Okay, so you have an internal or medial surface and external or lateral surface. So now we will try to understand what are all the structures which are attached to the borders faces of the larynx. The first, if you look at the upper border, it is anteriorly it is convex and then it becomes concave posteriorly. So the superior or the upper border gives attachment to this membrane which is called as the thyrohyoid membrane. So the thyrohyoid membrane, you are able to see here, extending from the superior border of the thyroid cartilage to the hyoid bone. Okay, so and you are able to see this membrane is pierced by the internal laryngeal nerve and superior laryngeal vessels. Okay, and this membrane is also thickened in the anterior midline and also laterally as the median and lateral thyrohyoid ligaments. Okay, it is called as the median and lateral thyrohyoid ligaments. Okay, then next what happens is the thyrohyoid membrane not only attaches exactly to the lower border but a little bit deep to it on the inner aspect on the above the lower border of the hyoid. So there is a space which is called as the subhyoid bursa. Okay, so thereby when the larynx is elevated during the deglutition, so the larynx is elevated to close the laryngeal inlet, then that subhyoid bursa, the thyroid cartilage is accommodated there. Now coming to the inferior border, it is somewhat concave anteriorly and then horizontal posteriorly. So the inferior border, what muscle is attached is the cricothyroid muscle. So you are able to see the cricothyroid muscle which is attached to the inferior border. So it has got two parts. One is actually the oblique part and other one is the straight part. Okay, so straight and the oblique part of the cricothyroid muscle which is attached to the lower border of the lamina of the thyroid cartilage. So this is the only extrinsic muscle of the larynx which can be seen. Okay, so then if you look at the inner border, mainly the inferior border of the thyroid cartilage gives attachment to the conus elasticus. So you are able to see, so that is the conus elasticus. The conus elasticus is the anteriorly it is present deep to the lamina. Okay, and in the midline again it is thickened to form the cricothyroid ligament. Okay, so it is mainly thickened to form the cricothyroid ligament, and if you trace it internally, it forms a membrane that is called as the conus elasticus. Then the posterior border. If you look at the posterior border mainly, it receives the insertion of the three muscles, the longitudinal muscles of the larynx, that is your salpingopharyngeus, the palatopharyngeus, and then the stylopharyngeus. So these three longitudinal muscles of the pharynx, they are attached to the posterior border of the lamina of the thyroid cartilage. So thereby when during the deglutition, these muscles contract and they elevate the pharynx. Here you see a space deep to the hyoid bone, especially the lower part of the body, the subhyoid bursa, where the larynx can get accommodated. If you look at the posterior border, it also shows an extension which is called as the superior horn or superior cornua. Same way you also have the inferior horn or inferior cornua of the hyoid bone. The superior cornua gives attachment to the lateral thyrohyoid ligament. The inferior cornua makes a joint with the lateral surface of the cricoid cartilage, that is the cricothyroid joint. Okay, so the superior cornua, what is attached is the lateral thyrohyoid ligament, and inferior cornua is actually making a articulating with the side of the cricoid joint, forming the cricothyroid joint. Then the lamina, we have seen about the superior border, we have seen about the inferior border and the posterior border. Now coming to the lateral surface of the thyroid cartilage, you see an oblique line, oblique ridge or oblique line of the thyroid cartilage. So this oblique line mainly gives attachment to the inferior constrictor muscle of the pharynx. So this is mainly you are able to see here the thyropharyngeus part of the inferior constrictor is attached here, and along this oblique line one more muscle is attached there. Two infrahyoid muscles are attached. So one is the sternothyroid muscle, and other one is the thyroid to hyoid bone, that is the thyrohyoid. Sternothyroid inserts and thyrohyoid originates. Okay, so thyrohyoid is actually considered as the upper extension of the sternothyroid muscle. They are the infrahyoid muscles, so which I have discussed in detail in my anterior triangle lecture. Okay, then coming to the internal surface. So when you look at the internal surface of the thyroid cartilage, you are able to see these two or the lamina, they meet in the midline at an angle which is called as the angle of thyroid cartilage. So to the internal aspect of the angle of thyroid cartilage, mainly there are structures attached from above downwards. So first on top what you see is the ligament, which is the mainly called as the thyroepiglottic ligament. Okay, so that is the thyroepiglottic ligament through which the epiglottis is attached to the thyroid cartilage, that is the thyroepiglottic ligament. Then below that you see a pair of vocal ligaments which is also called as the false vocal cords. Then below that you see a pair of uh, vocal ligaments. This is false vocal cords or vestibular ligament, and this is actually the pair of vocal ligaments which you are able to see here. Okay, they mainly form the vocal cords. Lateral to these vocal ligaments, you have vocalis muscle. Okay, you have the vocalis muscle lateral to this vocal ligament, and not only that, one more muscle more laterally you see is the thyroarytenoides muscle. So the thyroarytenoid muscle and also the aryepiglotticus muscle, all these can be seen lateral to the vocal ligaments. Lateral to the vocal ligament you have vocalis muscle, more laterally you have the thyroarytenoid and then the aryepiglotticus muscle. So that is the thyroarytenoid and the thyroepiglotticus muscle which is seen more laterally. So these are the structures which are attached to the inner aspect of the lamina of the inner aspect of the angle of the thyroid cartilage. The lamina on the internal aspect, it will be covered by the mucous membrane, and the lamina and above the thyrohyoid membrane, they form the lateral wall of the pyriform fossa or the pyriform sinus. So mainly they form the lateral wall of the pyriform fossa or the pyriform sinus lined by mucous membrane. And you know this membrane will be pierced by the internal laryngeal nerve and superior laryngeal vessel. Okay, coming to the next cartilage, which is the epiglottis. So the epiglottis mainly is like a leaf-shaped cartilage. So the epiglottis is actually called as the leaf-shaped cartilage. Mainly it has got a broad upper part. Okay, it is a broad upper part and the lower part is somewhat narrow and pointed. The broad upper part is also mostly free, especially the upper end is free, and then you have two lateral margins. Okay, so you have the two lateral margins. The lower narrow end is actually connected to the angle of the thyroid cartilage. That is the internal aspect of the angle of thyroid cartilage by the thyroepiglottic ligament. This we have already seen in the last slide. Structures attached to the internal aspect of the thyroid cartilage. Okay, so the epiglottis is attached to the via thyroepiglottic ligament, and this epiglottis is mainly made up of the elastic cartilage. Then, if you look at the two lateral margins, mainly what is attached is the aryepiglottic fold. So here you are able to see the aryepiglottic folds on either side attached to the lateral margins, especially the lower part of the lateral margins, whereas the upper part is again free. The aryepiglottic fold is a mucus fold. You are able to see that, and it mainly forms the boundary for the inlet of the larynx. On either side, it forms the boundary for the inlet of the larynx. And along this fold, again, two muscles run, mainly the aryepiglotticus and the thyroepiglotticus muscle. They run on this. Okay, next you are able to see in the anterior surface of the epiglottis, upper part is somewhat free. Okay, and you are able to see it is at upper border is only free, but the anterior surface gives rise to two folds which are attached to the posterior most part of the tongue. That is the median glossoepiglottic and two lateral glossoepiglottic folds. One median glossoepiglottic fold and two lateral glossoepiglottic folds. We are able to see that through which the anterior surface of epiglottis is attached to the tongue. So the depression between the one median glossoepiglottic and two lateral glossoepiglottic folds is the vallicula of the tongue. Okay, so that is actually called as the vallicular part of the tongue. So the main function, why it is a little bit projecting above than the level of the thyroid cartilage. Okay, so thereby it helps to deflect the food into the two lateral channels. Okay, not directly enter, but not necessarily nothing enters or passes through this. Some liquids or certain matter passes, but majority of the bolus of food actually is deflected to the either side of the lateral food channels. Okay, and this epiglottis actually they project beyond the what do you call as the uh, hyoid bone. Okay, now the lower part of the posterior surface, you are able to see here, this is the lower part of the posterior surface. It is again covered by the mucous membrane and forms the part of the laryngeal cavity. So it forms the anterior wall of the laryngeal cavity, that is mainly the lower part of the posterior surface, and it presents a tubercle in the lower part of the surface. Okay, so that is the aryepiglottic fold you are able to see here, and this is actually your lateral glossoepiglottic folds, and that is your posterior part of the tongue. Okay, now the anterior surface and upper part of the posterior surface alone is lined by stratified squamous non-keratinized epithelium. The remaining part of the posterior surface is lined by the respiratory epithelium or the pseudostratified ciliated columnar epithelium. So it is called as the pseudostratified ciliated columnar epithelium. Why this is so? Because what happens is, I told you the food enters as the two lateral channels, or sometimes it may also pass in the midline. If at all it is lined by the respiratory epithelium, naturally it might irritate the epithelium and it might produce a cough reflex. So that is one of the main reason it is lined by stratified squamous epithelium. So whereas the remaining part, so it should be protective in nature. If any food particles also enter or any foreign body enters accidentally, naturally this ciliated columnar epithelium will actually elicit a cough response. So that is why you have two types of epithelium with respect to the epiglottis. Okay, so that is about the epiglottis. Next, we will pass on to the cricoid cartilage. So the cricoid cartilage, when you look at it, it is mainly called as the keystone of the larynx, and it is in the form of a signet ring shaped. Okay, so it is like a signet ring. You are able to see that, and it is the keystone of the larynx. Why actually it is called as the keystone of the larynx? Because see, above the lamina, it receives, or the base of the arytenoid sits over it. So the arytenoid cartilage actually articulates with the cricoid cartilage. Same way the thyroid cartilage, inferior horn, articulates with the side of the cricoid to cricothyroid joint. This is cricoarytenoid joint. So all three cartilages, they form one unit, is mainly because of the articulation of this cricoid cartilage. So that is why it is actually called as the keystone of the larynx. Okay, that is one reason. And the second reason is, so the arytenoid cartilage makes various movements. Okay, that is, it is a synovial joint between the cricoid as well as the arytenoid. So due to the various movements of this arytenoid cartilage, the vocal cords are actually adducted or abducted. Same way, due to the various movements between the cricoid and the thyroid cartilage, the vocal cords are actually tensed or relaxed. So all the movements of the vocal cords are mainly brought about by these two joints. So that is why this is considered as the keystone of the larynx. So present opposite the level of the sixth cervical vertebra. So it is actually present opposite the level of the sixth cervical vertebra, and the presenting parts are, anterior narrow part is actually called as the arch of the cricoid cartilage, and posterior broad part is actually called as the posterior lamina of the cricoid cartilage. So it has got an anterior arch, and then you have a posterior lamina. Posterior aspect of these lamina, you see a vertical ridge. Okay, and on either side of the vertical ridge, it is somewhat depressed, and mainly it receives, two muscles are actually attached to this area, or the depressed area, which is the posterior cricoarytenoid muscle. Same way, this ridge also receives the insertion of the muscle fasciculae of the esophagus. So a conjoint fasciculus of the inner circular and outer longitudinal muscle of the esophagus is also attached, and the lower border of the lamina, the trachealis muscle is attached, because the tracheal rings are only present anteriorly and laterally, hyoid cartilage. Posteriorly you have the trachealis muscle. So that is also attached to the upper border of the, to the lower border of the lamina of the cricoid cartilage. Okay, so next, coming to the other parts of the cricoid cartilage, first we will try to understand the arch. So that is the anterior arch, which is narrow, and you are able to see what muscle is attached to the external aspect of the arch, that is the cricothyroid. So the cricothyroid muscle extends from the anterior arch to the lower border of the thyroid cartilage. This muscle will be supplied by the external laryngeal nerve. So this is a tensor of the vocal cord. So with the muscles we will be discussing in the second part of the larynx lecture. Okay. Then what happens is the deeper aspect of the anterior arch of the cricoid cartilage. So now the cricothyroid muscle has been removed. And the deeper aspect, you are able to see one more muscle, that is the lateral cricoarytenoid muscle. So it arises from the arch of the cricoid cartilage and goes to the muscular process of the arytenoid cartilage. So lateral cricoarytenoid muscle you are able to see in a deeper plane. Then what other structures you come across? So that is your cricoid cartilage anterior arch. Then you are able to see one ligament which is a stretching thickening of a membrane, which is the median cricothyroid ligament, the anteriorly from the upper border of the arch of cricoid to the lower border of the thyroid cartilage. You see that. Then to the inner aspect of the arch you see one membrane which is expanding, that is called as the cricovocal membrane. If you trace the cricovocal membrane anteriorly, it will be continuous with one more membrane, which is the conus elasticus. So sometimes some of the authors, they describe the cricovocal membrane and the conus elasticus is the same because they are somewhat conical in nature. So the cricovocal membrane continues anteriorly as the conus elasticus, and the upper border of the cricovocal membrane is thickened to form a ligament. Okay, so that I will come to the ligaments part after finishing the cartilages. So inner aspect, mainly you are able to see the attachment of the cricovocal membrane. Then from the lower border of the arch you see one more ligament, that is the cricothyroid ligament, which stretches from the lower border of the arch of the cricoid cartilage to the first tracheal ring. So that is the cricotracheal ligament from the lower border of the arch of the cricoid cartilage to the first tracheal ring. Okay. Upper border of the lamina of the cricoid, upper border of the lamina of the cricoid cartilage articulates with the base of the arytenoid cartilage. So that I will come to it later. And then at the junction of the arch and the lamina, or at the sides of the cricoid cartilage, the inferior horn of the thyroid, this is the superior horn, this is the inferior horn of the thyroid, articulates to form the main joint, that is the to form a joint which is called as the cricothyroid joint. So the next cartilage which we are seeing is the arytenoid cartilage. So it is a pad cartilage. The arytenoid cartilage is actually a The arytenoid cartilage is actually a pad cartilage, and it is partly hyaline in nature and partly what do you call elastic in nature. So roughly pyramidal in shape. The presenting parts of the arytenoid cartilage are, it has got a base. So that is called as the base of the arytenoid cartilage. And then the opposite of the base is the apex of the arytenoid cartilage, which is again made up of the elastic cartilage. Okay, on top of the base it articulates with the corniculate cartilage. Okay, then the other parts, it has got a anterior process which is called as the vocal process. To the tip of the vocal process, mainly what you see is the vocal ligament. So the vocal ligament will be attached to the tip of the vocal process, and still more laterally you come, it receives the attachment of the vocalis muscle. Lateral to the vocal process you have the vocalis muscle. So main one anterior process is the vocal process. Then you have one lateral process which extends laterally. Okay, that is actually called as the muscular process. So the muscular process mainly receives the attachment of the lateral cricoarytenoid in the front and the posterior cricoarytenoid behind. So because it receives the two muscles, it is called as the muscular process. This is the medial surface and that is the lateral surface. So lateral surface, vocalis muscle you have, and in the front, in the muscular process, you have the lateral cricoarytenoid muscle. More above, it will have the airy epiglottic fold and also thyroarytenoid, and muscle is also present, which is attached to the other borders. Okay, that is the above surface, lateral surface above area epiglottic, and also attachment of the quadrate membrane. So we will try to understand the quadrate and vocal membranes in the while we discuss about the membranes of the larynx. Now coming to the two small cartilages which you are able to see, one is the corniculate cartilage, which is situated above the arytenoid cartilage. Okay, so that articulates with a apex and it is present in the airy epiglottic fold, so which mainly forms the lateral boundary for the inlet. The next cartilage is a small rod-shaped cartilage which is called as the cuneiform cartilage of Risberg. So these two are elastic cartilages and they are situated in the airy epiglottic fold. That means they help to keep these folds propped up. They prevent the collapse. Okay, so when the larynx is elevated, so what happens is these folds should not collapse. It should be propped up so that food only passes via the pyriform fossa, because airy epiglottic fold forms the medial wall of the pyriform fossa. So to prevent the folds from collapsing, these two cartilages offer a firm support. Okay, so we have finished with the paired and unpaired cartilages of the larynx. So now coming to the joints of the larynx, mainly you have two joints. So the first joint you are able to see is the cricothyroid joint. So the cricothyroid joint is actually a synovial joint. So it has a capsule and lined by the synovial membrane. It is between the inferior horn of the thyroid cartilage and the lateral surface of the cricoid cartilage. It permits mainly you are able to see gliding movements. So because of the gliding movements, you are able to see the range of movement is around 15 degrees, and it permits the gliding of the cricoid cartilage with the thyroid fixed, or sometimes it might have the cricoid fixed and the thyroid to glide near to the cricoid. Both views are actually accepted, and this mainly is brought about by the cricothyroid muscle to stretch or tense the vocal cord. So to stretch or tense the vocal cord, so this gliding movement takes place, and also what happens is around the transverse axis some rotary movements is also possible. Next joint which you are seeing is the cricoarytenoid joint, which is between the base of the arytenoid cartilage and your upper border of the lamina of the cricoid cartilage. Here also again two movements you are able to see. One is the gliding movements, which is around 30 degrees. So due to the gliding movements, the two arytenoids may actually fall apart or they might come near to each other. So when they fall apart, they will abduct the vocal cords, and when they come nearer, they will adduct the vocal cords. Okay, that is one thing. Second thing, actually, what happens, adduction and abduction also takes place by one more method, by the rotary movements. So thereby the muscular process can be pulled anteriorly by the lateral cricoarytenoid muscle, or the muscular process can be pulled posteriorly by the posterior cricoarytenoids. So thereby when the muscular process move to the front and back, the rotation of the arytenoid takes place. So rotary movements is also possible. They also bring about the adduction and abduction of the vocal cords. So the movements again in detail with respect to the vocal cords we will discuss in the second part of the larynx. Okay, so that is about the cricoarytenoid joints, which permits both gliding as well as the rotary movements. So rotary movement is around the vertical axis. Okay, so next coming to the ligaments and membranes of the larynx. So first the ligaments and membranes connects the cartilages, various cartilages of the larynx and membranes mainly, and the thickening of the membranes are actually called as the ligaments of the larynx. There are two types, mainly extrinsic and intrinsic ligaments. So extrinsic ligaments which you are able to see on the external aspect. Now first coming to the extrinsic ligaments, mainly you see the thyrohyoid membrane. So that is actually called as the thyrohyoid membrane. Extends from the upper border of the thyroid cartilage to the hyoid bone. Okay, it is pierced by the internal laryngeal nerve, and in the anterior midline, what happens? This membrane thickens to form the median thyrohyoid ligament, and posterior laterally it is also thickened to form the lateral thyrohyoid ligament. So in that ligament only you see the cartilage, that is the cuneiform cartilage. You are able to see that. So this membrane, medially you have the mucous membrane and the airy epiglottic fold. Okay, so these are the two ligaments. One is the median and lateral thyrohyoid ligament, and deep to the lower border I have already discussed about the subhyoid bursa, which accommodates the thyroid cartilage during the elevation of larynx, that is during the deglutition. The next ligament what you are able to see is the thyroepiglottic ligament, through which the narrow pointed lower end of the epiglottis is attached to the inner aspect of the angle of the thyroid cartilage. That is called as the thyroepiglottic ligament. Then the epiglottis is also attached to the hyoid bone by a ligament which is called as the hyoepiglottic ligament, from the anterior surface of the epiglottis to the hyoid bone. Now this in macrosomatic animals, this ligaments is hyoepiglottic ligament is a muscle, hyoepiglottic muscle. So thereby what happens is they always helps to keep the larynx open and propped up. Because of that, what happens is they can swallow at the same time during breathing. Okay, and the epiglottis is very long and reaches up to the level of the nasopharynx. So the epiglottis also subserves the function of olfaction. Okay, they also subserve the function of olfaction, mainly the macrosomatic animals. Okay, the next coming to the other ligaments, cricothyroid ligament, median cricothyroid ligament, you're able to see, which is a thickening of the cricovocal membrane. That cricovocal membrane here, it is wrongly labeled as lateral thyrohyoid, which is wrong. Lateral thyrohyoid ligament is here. So median cricothyroid ligament, from the lower border of the thyroid cartilage to the cricoid cartilage, you are able to see it is actually a thickening of the cricovocal membrane. Then from the lower border of cricoid to the trachea, what you see is the cricotracheal ligament. Okay, so that is actually called as the cricotracheal ligament. So next we will move on to the intrinsic ligaments. Intrinsic ligaments and membrane. So first ligament, since they are present inside, they are called as the intrinsic ligament, the cricovocal membrane. So this is the cricovocal membrane. The anterior part of it is continuous with the conus elasticus, or as I told you, some authors consider the cricovocal membrane and conus elasticus as the same. So from the upper border of the arch, the membrane expands. Okay, and it is going extending up to the arytenoid cartilage. The upper border of the membrane you are able to see here is thickened to form the vocal ligament. The upper border of the membrane is actually thickened to form the vocal ligament. Okay, so this vocal ligament extends from the vocal process to the internal aspect of the angle of the thyroid cartilage. So the vocal ligament is nothing but the thickening of the cricovocal membrane and conus elasticus, or some books consider the conus elasticus as the anterior part of the cricovocal membrane. So that is the attachment of the vocal ligaments anteriorly to the inner aspect of thyroid and posteriorly to the vocal process or the anterior process of the arytenoid cartilage. Now this vocal ligament, vocal process, and more laterally you have the vocalis muscle, are all covered by a layer of mucous membrane and thus forming the vocal folds. So vocal fold is a mucous membrane covered vocal ligament, vocal process, and more laterally the vocalis muscle. Next, coming to the next membrane, intrinsic membrane, which is called as the quadrate membrane. So it is roughly quadrangular in shape, so that is why it is called as the quadrate membrane. So from the epiglottis downwards and backwards, and attaches posteriorly to the arytenoid cartilage lateral surface. Okay, so this quadrate membrane lower part is thickened to form the vestibular ligament or the false vocal cords. Okay, so the lower part is thickened to form the false vocal cords. Cricovocal membrane upper part is thickened to form the true vocal cords or vocal ligament. This is the vestibular ligament. And more above, if you trace, you can see the airy epiglottic fold. Okay, so the upper end of the airy epiglottic fold. So that is the quadrate membrane which stretches from the epiglottis to the arytenoid cartilage, and the lower part is thickened to form the, what do you call, the vestibular ligament. Okay, now this is again covered by a mucous membrane. So the mucous membrane covering the vestibular ligament forms the vestibular fold. So between the conus elasticus or cricovocal membrane and the quadrate membrane, the sinus of larynx intervenes, or to be more precise, between the vocal fold and the vestibular fold, what you see is the sinus of larynx. So here you are able to see a laryngoscopic view. This is your vocal folds, sorry, vestibular folds, and below that is the vocal folds, which is white in color. That should be your vocal folds. Okay, so vocal folds is below and false vocal cords, or actually the vestibular folds, is above. So little bit of mainly coming to the clinical aspects. Inflammation of the epiglottis, or also called as supraglottitis, is mainly due to Haemophilus influenza B virus, or sometimes even streptococcal virus. From the throat or pharynx, it might go and spread to the epiglottis. So if not treated properly, can also lead to airway obstruction, so which can prove fatal. Omega epiglottis is a condition where the lateral free borders of epiglottis are curled inwards. So in radiological examination, this curling might appear as a thick shadow, and it might mimic epiglottitis. But even though it does not form epiglottitis, it is more prone for laryngomalacia. Then the cricoid cartilage is only forming a complete ring, the arch and the posterior lamina, whereas the thyroid has got only protection anteriorly and laterally by forming a shield. So the posterior lamina, when you insert for the instrument for emergency in tracheal intubation or endotracheal intubation, so what happens is that instrument can be, pressure can be applied over the posterior lamina of cricoid cartilage to compress the esophagus to prevent any regurgitation, because if there is a regurgitation, that might get aspirated into the, again into your respiratory tract. So what happens that during endotracheal intubation, pressure can be applied over the posterior lamina. Since the thyroid and cricoid cartilages are made up of hyaline cartilage, they tend to ossify as age advances. So mainly it starts by 30 years and complete by 60 years of age. But the apex of the arytenoid or the vocal process are elastic, so they don't get ossified, so the movement of vocal cords is not affected. Same way corniculate and cuneiform is of elastic, they don't get ossified, so the inlet is always maintained propped up, so that it is a protective mechanism to prevent any foreign material entering into the laryngeal cavity. So with this, I will complete the first part of the larynx. So let us actually discuss more aspects of the larynx in the second part. Thank you.